Good afternoon, everyone. We're going to give members of the local press a few more minutes to log into our Zoom webinar. We'll get started in just a few minutes. Good afternoon, everyone. We still have some people tuning in. We'll get going here in 2 minutes at 12:35. Thank you. Good afternoon, everyone. Thank you for being here. For those of you who don't know me, I'm Jason Maurer. I'm with the Sheriff's Office. I'm currently assigned as the Chief Public Information Officer for the Sweetwater County COVID-19 Emergency Operations Center. As I'm sure everyone's aware, last night around 6:05 p.m., we received notification from the state of our first confirmed positive COVID-19 patient here in Sweetwater County. I want everyone to know that the Emergency Operations Center primary objective is to continue to work together with public health and our local medical community to contain the spread of COVID-19 in Sweetwater County. And our goal is to keep the number of confirmed positive COVID-19 cases in Sweetwater County as close to zero as possible. So with that, I have some guests today. Joining me is Sweetwater County Public Health Director Kim Lionberger, Sweetwater County Public Health Officer Dr. Jean Stachon, and I also have, as a last minute addition, Memorial Hospital of Sweetwater County Incident Commander Kim White. How I'd like to proceed, since we're trying to obey all the social distancing rules here ourselves, we're only going to be able to put one person in front of the camera at a time. I would ask that members of the press please identify yourself by name and organization. And then if whoever is speaking is not the best person to answer the question, we'll just make note of that. And when we move on to the next guest, we can revisit those questions. Are there any questions before we begin from members of the press? Okay, can everyone who's in attendance at this meeting hear me? Can we confirm that, please?
Yeah, we can.
I can hear you, Jason.
Thank you, guys.
Jason, quick question.
Yes, sir.
It says this is live on YouTube right now.
Yes, sir.
Is that private or public? We just want to make sure.
It's public and it's accessible via Sweetwater County Government's YouTube channel.
Okay, perfect. Thank you.
Yep, you bet. So we don't have a lot of time, as you can imagine. First guest is going to be Sweetwater County Public Health Director Kim Lionberger.
Good afternoon. My name is Kim Lionberger. I'm Director of Public Health. They're asking questions to me, or am I providing information?
No, they'll ask.
Okay.
Any questions for Kim?
Everyone's muted. I can see everyone's mics are muted.
Hey, Kim, sorry about that. I don't know. They were going to get on there and ask you something, but some of the questions that we had. Oh, sorry. Go ahead, Dave. So are you seeing an increase in the number of patients coming in to get tested? And I assume right now that's just up at the hospital.
It is. And so I will let the hospital answer that question, because the public health at this point in time, we are not doing testing at our office.
And so are you seeing an increase in patients, or is it still, the same as it has been for a week now, or,
that's the hospital, because I honestly have no idea how many numbers are going through.
Okay, so we'll ask her.
Totally different. Yeah, that'd be a hospital question.
Hi, Kim. This is Dave Arabell with Sweetwater Now.
Hi, Dave.
Quick question for you. Do you know how many people may have come in contact with the infected individual? And are those people being quarantined now?
Those people are being quarantined now. It's with immediate family at this point in time. And so there were not that many contact tracings that came from that positive. And he self-quarantined. He didn't leave anywhere. He didn't go anywhere after he tested. He did exactly what we ask everyone to do that is tested for COVID-19, and that is go straight home to your house. Don't go to Walmart. Don't go to Smith's. Don't go to any other location. Once you have that COVID test swab, you go straight home and don't leave the house until you get test results back. And that's exactly what this individual did.
Okay. This might be a question. Go ahead, Gary.
I was going to say, no, yeah, but with that, even though he is now self-quarantining, what about the contact that he had before he was tested when he still was maybe anti-symptomatic? Are there precautions? Are people been reached out to see if he could have spread that while at work or traveling or otherwise?
Right. So what happens is we were notified of that positive result. We contacted the state health department. They followed up their contact investigation today. Talking to state health department, what they do is find out when this person was symptomatic. They will ask where have they been when those symptoms were occurring. This individual had not been at work while he was symptomatic, and so there wasn't anyone to really contact other than the immediate house. Can you repeat the question to make sure that I answered it correctly?
Yeah, I was just curious, what precautions were taken to see who he might have infected before his positive test.
Yep. So the state health will come in and do a much more extensive contact tracing type thing. This particular individual, the immediate household, they are all quarantined currently.
Another thing, Kim, what is as far as countywide, the preparation and resources such as number of ventilators, obviously number of beds could differ based on if triage situations through the MOUs with hotels and stuff like that. But as far as right now, what does it look like as far as some of those resources available to our county?
So I'm also going to let the hospital answer that question since they have more knowledge of all the resources at the hospital, and that's where if these patients are hospitalized, they'll be there. So I'll let the hospital answer that question.
Okay, and what about testing from the state? It seems like it's been kind of tough getting some of those results back in a timely manner. And as far as even receiving testing kits, I mean, are we okay now as far as the county goes? I know some counties are still kind of in limbo on even receiving the ability to test. Are we seeing that bottleneck slow down at all? Or?
So as far as capacity of the state lab goes to test, they ramped up their ability to process samples. And at this point in time, to the best of my knowledge, they're pretty much caught up on all of the tests that they've received. On a call that I was on with them on Monday, they had processed every single test but 25. And so the turnaround time should be improving with the state lab. The turnaround time on this particular positive, the test went out Friday and we had results last night. So but that wasn't through the state lab. That was through an outside, through LabCorp that went through a physician's office. So state tests, they have ramped up, and I don't know the turnaround exactly. As far as testing supplies and kits go, as far as I know, to the best of my knowledge, the hospital has enough swabs to collect specimens. Once you collect a specimen, it goes into what's called viral transport media. That is in short supply across the nation. The hospital, to my knowledge, it has a sterile saline transport instead of the viral media transport, which it means that there shouldn't be a short supply like there is with the viral media transport, but that is across the nation. That is a shortage.
Hey, Kim, Braden Flack with Sweetwater now. Just kind of jumping back to the positive case we had last night. I was curious what symptoms, he was showing. Was it all the symptoms or only a few of them? What knowledge do you have on that?
He has a mild case. It wasn't a severe respiratory case. He'd been sick for a couple days, well enough to stay home, which is what needs to happen. That's exactly what you do if you are feeling these symptoms. The majority of the time, you're going to be well enough to stay home and isolate yourself. And that's the best thing that you can do so that you don't pass it to anyone else who may not have the ability to have those minimal symptoms.
Hi, Kim. This is Dave again at Sweetwater Now. You're seeing on the national news how they're predicting or projecting that this is going to peak in possibly 3 weeks or so. Is there any projection for the county as to when you think it might peak here in Sweetwater County or even Wyoming?
I think that sounds like a good question for Dr. Stachon, the county health officer, to answer. Do you want her now, or is there? We can switch and move someone else if everyone has. Go ahead.
Yeah.
I mean, maybe Kim, if you can just give us whatever information that you think would be important for us to get out to the public from your end, and then we can talk to Dr. Stachon. Does that work?
Okay. I think the most important thing is that right now, currently we have one positive COVID case. We don't know of anything else at this point in time. We've only have that one identified. There are state of Wyoming websites, I'm sure you guys are familiar with them, where you can go and track numbers across the state. There's tracking devices that you can track across the nation and globally. But I'm going to let Dr. Stachon, who's really passionate about social distancing and focusing more on, just because we have some of these tests going out, there's more important things to kind of consider. So I'm going to turn it over to Dr. Stachon to answer some of those questions. Thanks, guys.
Thank you.
Thanks.
Am I on now, or hello?
We can hear you.
Okay, like I said, this is an impromptu, so didn't do my hair this morning, but anyway, go ahead. Let's hear your questions. I'm happy to be here and able to answer this. I think this is important, and it helps with our messaging, and I think you are vital, our media and our news outlets, in being part of this, preventing the spread. You can do more online than I can say to one person individually. You reach a larger population. So thank you for helping us get this message across. Go ahead with your questions.
Dr. Stachon, what is the county's emergency plan if all of a sudden more tests are confirmed in a pretty quick manner, let's say by this weekend?
Oh, I would expect that right now we have quite a few positives in our community. We just haven't been able to prove it. The county has plan in place, like we were saying. The big important thing is to try to prevent spreading it. And at this point, everyone should be treating themselves as if, gee, could I potentially have this and just not know it yet? Or am I in the same room with someone who could have it and doesn't know it, and they're spreading it to me? That's why the message of social distancing, limiting how close you are to each other. If you notice, we're on this conference one at a time at this desk. We're not jumped up here close together. We're keeping our distance. The hand washing, all of those things are vital, because I'm sure it's out in our community. We just don't have numbers to prove it yet, but we will. I mean, the doubling time is thought to be every 2 to 3 days. So the numbers are going up, and weeks and months. And that's why we talk about flattening the curve. And I don't know if people are understanding that epidemiological concept of how to flatten that curve. Do you understand that concept, or would you like me to explain that?
I think most of us do, but we'd love for you to explain it. I know this will be out to the public, and I think that'd be helpful information for all of them.
Well, what it means in plain talk is, just like I said, if one person has it, how many people they come in contact with can spread that. And numbers have shown that it's pretty much every couple of days, there's twice as many positive as there were the day before. And in our community, we've identified one, but there are more than that. The concept of flattening the curve is that you limit your contact with other people so it doesn't go anywhere else, and you stop that spread with that person right there. And that's vital and huge. The thinking is in the United States, we're probably our peak is still 3 to 4 weeks ahead of us. And that this will go on, for months. And so the big important thing, like I said, is social distancing. I mean, it came out yesterday. You might not know it, but if you have a smartphone, you're probably contributing to a massive coronavirus COVID-19 surveillance system, because it's revealing where Americans have been and if they have or haven't been practicing social distancing. And right now, Wyoming is ranked the worst, number 50 of all 50 states in terms of social distancing. And you can argue, well, I-80 comes through here, people are always moving and traveling, but it goes through other places too. And Alaska, Montana, Nevada, I mean, people drive around a lot there too, ranchers going out and doing things. So it's very telling that the people in the state of Wyoming are not getting this concept of social distancing, and you can't hammer that home enough.
Hi, Dr. Stachon. This is Dave Arambell at Sweetwater Now. The Washington Post recently published an article that stated that there could be widespread shelter-in-place orders across the country. Do you anticipate something like that happening in Wyoming or in Sweetwater County?
I would like to think that some of our recommendations that are out there right now are pretty much almost just short of that. I mean, we're telling people don't get in groups. It could get to that, but right now it would be beneficial if people at least follow the concept of no groups, more than 6 feet apart. You might want to try little projects like, how do we stop the spread? I mean, having like online parties instead of in-person things, whatever you can do to distance. I don't know if I answered that well enough for you. Would you like me to?
Yeah, Dr. Stachon, to follow back up on that, what you had mentioned about Wyoming being the worst when it comes to social distancing, how close do you think, we are to maybe a shelter-in-place order, and who locally makes that call?
Okay, I have discussed that with Dr. Allie Harris, the state health officer, because I have said, we were having significant issues in our community getting testing and being able to prove we have it here, although we basically knew it was here. And people kept hinging on this first person. And I said, are we to the point in our county that since we can't prove it's here, should we be looking at more shelter-in-place type things? And she advised at this point, we're not going quite that far, but if you notice, they've sent 3 orders out recently, and more things get curtailed. I think what we're hoping is that the public will get the idea and they'll do what's right and stay home. We're Wyoming, a pretty independent group of people who don't like getting told what to do. And so the hope is nobody's going to tell you, you're just going to choose to do it on your own because it's the right thing to do for yourself, for your family, for your neighbors. How would you feel if you know that you unwittingly had it and spread it to somebody you really cared about? That's hard to live with. And we as Wyomingites care for each other. Sweet people in Sweetwater have always come forward with fundraisers for people in need and whatnot. Well, this is your way to do it now. The best thing you can do might be sitting at home with popcorn in front of Netflix. It doesn't seem dramatic, but it's the only way you're going to contain this in our county. You just assume that you've got it or somebody else does, and you act like that because you don't know. You could get sick and have a positive test tomorrow. And who have you been around right then? I think we haven't come out with a shelter in place as an order from state, but I think if people do what's right, they'll do things that are pretty similar on their own.
So what I'm hearing you say, Dr. Stachon, you would suggest even for businesses, if you can if your employees can work remotely for now, at least to slow the spread, please do that.
If you can do something remotely, definitely do. I mean, here we are now remotely. You're not in the room with us. We're practicing what we're preaching. You know, there are vital and necessary things, and this is a real economic hit on people. I understand that. I mean, I'm a private physician. I'm not employed by somebody who's paying me. I mean, I am the county health director, but my private practice is that. I mean, right now, we're not letting people in the door. We're doing things on Skype. We're doing things on Zoom. If they need to be seen, we do, but we're screening. We're moving a lot of things to online or over the phone, realizing, you know, we'll follow up with some things down the road, but for now, we're really trying to limit. You know, people are having their temperatures checked before they're in, even in the office. We don't have anybody in a waiting room. We're doing a number of different measures to cut down on spread and increase social distancing without compromising anyone's health. And our office is not the only one.
Dr.
Go ahead.
Braden Flack with Sweetwater now. I just had a question for you. You know, there's a few projections that have been made nationally about the peak of this virus, but I was just curious, from a county or state perspective, has there been any kind of projection on your guys' end as to when the virus is expected to peak here?
Best I can guess, and like I said, maybe I should get back to you on that. You know, we haven't hit our peak. We're just starting the upswing. I mean, they're estimating maybe 3-4 weeks, but I would think that's all the more reason we don't want an upswing. We want to contain it and not let it spread. I would be the happiest county health officer in the world if we could contain that spread in Sweetwater County by really doing the social distancing, hand washing, caring for each other, and doing what's involved in caring for each other, looking out for the other person.
Dr. Stachon, I'm going to follow up on that real quick.
And isolated.
Oh, I'm sorry. I'm going to follow up on that with Braden real quick, and then we'll let Dylan jump in too. But so Dr. Stamato, I'm sure you've seen the video up in Campbell County, comes out and says 10,000 people in Campbell County infected in the next few weeks, thousands hospitalized, more than 100 will die. We thought that was a little aggressive to put out into the community like that, but you know, are those the realities of the situation?
We don't have those kinds of numbers here, but I don't think that's an aggressive prediction at all. I think people need to take this seriously. This life is never going to be the same after this. This is changing how people should be behaving from here on out. I mean, not to the extreme where we're saying you never associate, but I'm sure there'll be more telemedicine. There'll be changes in how things are done. And then another thing to think of, the COVID-19 can live on some surfaces like plastic and stainless steel up to 3 days. CDC came out recently that after all the passengers had been disembarked from like the Princess Cruise Lines, 17 days later, they could still find evidence of virus there. So that's the purpose of cleaning down surfaces, washing your hands. Don't touch whatever, and then touch your face, your eyes, your nose. This virus is out there. And even though we have one confirmed case, that case, this gentleman was not in Seattle. This gentleman was not in China. This gentleman is community acquired. He got it somewhere in our community, and we don't know where that is. So and we may never know. So when it's community acquired, you know it's out there. Any other questions? Or I hope I'm harping enough on the social distancing message. I don't think it can be expressed enough. And some of these numbers, and I think Washington Post is a really good source, they are sobering, scary numbers, and they're real. This is a nasty, sneaky virus that does awful things to people. The majority aren't going to be deathly ill, but don't think because you're young and not in the high-risk group that you're not protected. In New York State, which is the hardest hit state in our nation, 53% of all their admissions are in young people. They don't have as high a death rate, but that doesn't mean they're not on ventilators and struggling to live. You can get very, very ill with this virus. And if you're not, then it's wonderful that you got a mild case.
Dr. Stachon, do you feel, maybe some final thoughts here, do you feel that Sweetwater County is adequately prepared for a rapid spike in positive cases?
Well, if we still have people not practicing social distancing, we will never be adequately prepared. I mean, this is something where it depends on the community. They're more important than even the healthcare facilities right now because they can stop people from needing those services. And that's the message I want to get out there. So if the community is not doing these things, no, we're not prepared and we never will be. It depends on the community. Would you like to
I think
talk?
that's all from us.
Do you have any other, I mean, am I getting my point across on how, if you're not going anywhere and you have it, you can't spread it. And you may not know you have it or have a mild case.
Right. Yep.
I mean, I think right now, unless you're, being, the only grocery stores, convenience stores, wash your hands, use those sanitizers when you go in. Don't cough all over the what's there. I mean, I'm over 60. I'm think going to the grocery store is one of the scarier things I do. I'm counting on other people to do their part and not go there if they're ill. And not to hoard supplies so that people that need them can't get them.
I think that's all the questions I have, Dr. Stachon.
Okay, well, thank you. Again, my parting message is, it's up to the citizens of Sweetwater County to do something now.
Hello, I'm Kim White. I'm from the Memorial Hospital. I'm the incident commander there. So I would love to open it up to any questions that you may have for me.
Hey, Kim, it's Gary Collins. So as far as equipment goes, can you give us the number of ventilators? And I don't know if it's only the hospital that has those available. I'm sure there might be another few out there in the county, but what's our capacity for that if things did all of a sudden spike?
Our capacity for ventilators is actually expanding every day. We have people that are offering us more equipment throughout the community. So to give you an exact number, it would not be the truth. So just to let you know that we are working on expanding those numbers every day so that we can be able to take care of the patients should we get those that require the ventilators. So that's continuing to be a work in progress. We do have a number right now. There's different ways that we can use them to take care of more patients, and we're working on all of that, but there's no definitive number that I could give you that would be accurate.
Okay, so less than 20, over 100. I mean, I think, we're getting asked a lot by the public.
Well, I can definitely
for this
tell you
information.
it's not over 100.
Right, exactly. And so, 11, 12, something like that. So within that, do you have patients currently in the ICU, maybe that were already, before all this started, using some of those resources?
No.
And so are you seeing an increase in the number of people coming up to get tested, maybe in the last, let's say, week or even this week?
Yeah, when we first started the swabbing station, we did see an increased number. I talked to the gals that were running the swabbing clinic yesterday. They said that they're averaging about 20 patients coming through. And this is the drive-through swabbing clinic or swabbing station at the 3000 College Drive. So those are not official numbers. They said that that's what they feel like they're averaging. I will say when I drove by today, there were 4 cars waiting there. So I'm not sure. We don't have the numbers for today, of course, yet. I know last night after it went out that things were positive, we did get more phone calls on our triage line and things like that, which we expected. So yeah, when the test was available, we've had consistent amount of people coming in and getting tested. I hope that answered your question.
Kim, this is Dave with Sweetwater now. You mentioned the triage line. Are you seeing a considerable increase percentage-wise, say like over a week ago, in terms of the number of people that are calling with symptoms?
When we first went live with that, we saw a lot more. When I've talked to the patients recently, it had gone down in numbers. We hadn't had quite as many. Again, last night, I think that increased a little bit. I haven't seen the numbers today to know if that has increased again after the report of a positive COVID in our community. When, like I said, when we first initiated a lot of these things, we saw more of an influx, but it's been more consistent since we started these and implemented these things. Sorry.
This is Braden Flack from Sweetwater now. Regarding the testing, if there are those who have, their tests come back negative, I know that they can test again, but is there like a protocol for that? Like a certain amount of time or anything regarding that you could enlighten us on?
We don't have a protocol for retesting. It's really based off symptoms. So should their symptoms go away and then they come back again, they can certainly be tested again. They may have rhinovirus or some other thing, and then it could later be COVID. So we don't have a protocol in place that's going to keep them from getting tested if they have the right symptoms that qualify for them for that test.
Kim, Gary again. So when it actually comes to the testing, I'm under the impression right now Memorial is the only testing facility in the county. And so are you using all the same testing? Like I understand there's like a nasal swab. Is there also, are there also other COVID-19 tests out there that we might use later or we're not using now? And maybe why was this one chosen? Is it because we can get a lot done over a short period of time? We just maybe want to understand, I guess, that process a little bit better.
Okay, it is nasal swabbing, all of it. It is a test that currently we are not able to run. We can swab, we can collect, but we're not able to run it at our facility. They're nationwide, they're working on a test that may eventually come to our facility. We would be pretty low on the ladder to get that just because they're anticipating rolling that test out soon. It's supposed to be a 45-minute test. That's how long it takes to actually run it. That would go to the hardest hit areas first. So it would go to New York. Louisiana is actually one of the states that they would send it to. California and Washington. We have the equipment to be able to do that once we are given the testing supplies needed for that. So that's one thing that may be changing in the future, but we have no date on when that may go. So right now we're having to send our tests out to other labs. But it is not, at this point, it is not any blood collection we're doing. It's strictly the nasal swabs.
And so to keep that obviously efficient, are you, or is anybody being turned away for testing that might not show appropriate symptoms? And if like you had to put a percentage on that, could you let us know maybe what that looks like, or even just getting the word out about, who should not come for testing?
Gotcha. And yes, when not everyone is getting tested just across the board, because as Kim Lionberger from Public Health said, there is limited testing supplies across the nation. So we do have to be diligent in who is getting the test. So they need to have the symptoms of COVID. So fever, cough, shortness of breath, things like that. So we are triaging those and making sure that they have the symptoms in order to qualify for the tests. We're doing that through the triage phone that I mentioned earlier. We're also doing that through our primary care providers. The ER is triaging. We do have that in place just to make sure that the right patients are getting that. As far as a percentage of who's wanting it versus who's getting it, I really don't have a number for you on that.
Sure. And I think more or less I was just, trying to reaffirm the process that if somebody does have the symptoms, they feel that they do, they have a fever, And I guess their first step is not to run up to the emergency room. It is to call that triage line, talk to a nurse, you talk them through that, and then you let them know if they need to come up.
Exactly. Either call that triage line or they can call their primary care provider, and their primary care provider can actually write the orders that they want to have come over and get that testing done. So either one of those two things, you know, sometimes that nurse triage line can get a little busy. We do have more primary care providers that are able to help with that as well and able to triage. So we're recommending either the triage line or their primary care provider.
I think that's all for us at Sweetwater now. I don't know if Dylan has any questions.
No, I think you guys have answered it pretty well.
Okay, well, thank you so much. I appreciate it.
Thank you.
Thanks,
Thank
Kim.
you.
Thanks, everybody. I appreciate your professionalism. Obviously, we'll be in touch, okay? Everybody,
Thanks for putting this together, Jason. We appreciate it.
Thanks, Jason. We appreciate it.
certainly take care, everyone.